country like Pakistan, understanding what healthcare is a hard thing. It's always been a hard thing to understand since its independence. It hasn't been given priority it should have been given, just like education. Due to the insufficient space and beds in the hospital, you can see 2 to 3 patients on one bed and no arrangements for the relatives to stay. They have to lie on the floor or have to sleep on the same bed as the patient. We asked a doctor from Jinnah Hospital, and our first question is, what's the capacity and the sufficient amount of this hospital? So we could know what exactly and how much can Jinnah Hospital take care of and what's the extent of this hospital. Even in emergency cases, we have seen that day case rooms have been changed to blast victim rooms because of the insufficient rooms and beds for the victims. It's always been like this, and as in the country, if we talk about the country, there are places where hospitals aren't even available or built upon, and still the people are waiting for the hospitals to be built by the government and supported by the government. So we are going to talk to Dr. Anam Arooj Tariq, who's a medical officer in Jinnah Hospital. And as I mentioned, the first question is, what is the capacity of this hospital, and what is the sufficient amount of people and beds it can handle?
Now the thing is कि जो यहाँ पे है it's a 1500 bedded hospital, right? But at any given time, at any given day, we are getting around 3000 patients in a 6-hour shift of any doctor of any department. Surgery कर लो, medicine कर लो, ENT कर लो. ठीक है, अब our capacity in the emergency per se is 20 beds. ठीक है, that is like including male and female sections. And if I'm getting 3000 patients with just 20 beds and I have a limited number of medications, I will not be able to treat them. Even if I prescribe something, I will not be able to give it to them. Okay, I have like 2 staff nurses. 2 staff nurses who have to repeatedly give medication to new coming patients with irritable attendants is not possible.
Pharmacies, there are a lot of companies that make the same medicine with low quality things. Like we can find fake medicines, expired medicines in the pharmacy. So our second question to Dr. Anam is that what's the limit, or do you have limited capacity of medicines in the hospital, or do you have everything that's available to you guys, or what's the process of it?
So when it comes to medications, take about whether what medications the patients needs and what we can prescribe, we have a limited supply. Okay. Also, in that limited supply, we have few medications which are not effective at all because they're bought from a very low class company. Even if we give them for like we give a person an antibiotic, we give them antibiotics for 3 days, they will not be effective because the medication being provided by the government is not effective. It is from a very low class company, so the patient suffers eventually even if you're prescribing the right medication.
Healthcare in Pakistan is mainly administrated in the private sector. The shocking thing is, health per capita is only 2.6% of the GDP, according to the 2014 budget. In Pakistan, approximately 1 in every 9 Pakistani women is likely to suffer from breast cancer, which is one of the highest incidence rates in Asia. Among the Asian countries, Pakistan has the highest rates of breast and ovarian cancer. Breast cancer in Pakistan kills nearly 40,000 women every year. And we would like to ask Dr. Anam that what kind of health issue occurs or shows up the most in the emergency? Like is it the pain in the abdomen, or is it pain in the heart, or is it diabetes, or people facing other issues? What's the most specific issue does doctor have to face with the patient? Which is the most common issue is the question in all of this.
अच्छा, most of the emergencies that come in a basic health unit या जो DHQ है, ठीक है, जो हमारे पास सबसे ज़्यादा आती हैं, that is related to stomach issues. अब the reason the people in our city have so many stomach issues is because they're usually eating stuff from outside, ठीक है, किसी भी ढाबे, रेडी वगैरह से, जहाँ पे hygiene is like -1, -10. उसके बाद they get such severe stomach issues कि they will start bleeding from the stomach, they will get stomach ulcers, they will get recurrent vomiting, and it usually takes a week or so to go away. And the problem with that is mostly okay, they need injectable treatment for that. Unless they get injectable treatment for that for like at least once or twice, they will not get better. One of the most what would you call it? One of the most epidemiologically progressive disease right now is cancer of many different things. We've got maxillofacial cancer, we've got breast cancer. Breast cancer is increasingly more common. Prostate cancer is very common. Now the problem with that is that most of the people in Pakistan are not affording. They cannot afford private treatment. They cannot afford huge hospitals. They cannot afford good chemotherapy, radiotherapy. Then obviously they're going to be coming to government hospitals. Now we've got Anmol, we've got Jinnah, we've got services. Now the problem is, since these are supposed to be the places you can go to if you've got cancer and get radiotherapy or chemotherapy, but places like Jinnah, they're already out of the radioactive element that they're supposed to be using to provide radiotherapy. So essentially the patient is going semi-treated or like almost not treated. And the chemotherapy isn't really particularly effective. So unless a cancer patient who's already dying has massive debulking, and if he has cancer in other parts of his body, he's not going to survive unless he goes to a private setup. Now the thing is, a lot of diseases we have these days, especially the acute ones, acute means which have started in the past 2 or 3 days, are usually happening because of the way people are living or where they're living. For example, जैसे हम लोगों के जो गंदे नाले हैं उसके इर्द गिर्द हमारी बहुत ही dense आबादी है. If we take just that area, if we take an area near Manama per se, or we take an area in Old Lahore or somewhere where there's a huge water supply going which is not sanitary or which is not being cleaned repeatedly. Taking Manama, we've got a place which is highly populated, which is congested, the housing is bad, it is near dirty water, not even dirty, it's near, what would you call it, contaminated water. And the thing about that contaminated water is that the water that they're supposed to drink, the pipes of that contaminated water and of the water that they're supposed to drink are going side by side, and there is usually a lot of mixing, which leads to a lot of problems. We've got typhoid, we've got cholera, and we've got all other diseases which are related to the GI tract because of this. And because of the congested population, we've got tuberculosis. If one person in a family of 5 has tuberculosis, and since they're living in small houses, all of the people, including the children, will get tuberculosis to a certain level. It could be an acute flare-up, it could get worse. People who go to barbers, everybody goes to barbers these days, right? But people who are from a lower socioeconomic status go to barbers, they will not use clean knives, they will use needles which have already been used. And because of that, we've got an epidemic of HCV on our hands. HCV is basically hepatitis C. The problem with hepatitis C is that it will start with an inflammation of the liver, which basically means that it goes into the liver and it starts making it expand. Because of the expansion, the liver stops working. After that, it starts decreasing the liver, because of which the liver completely shuts down and the body starts to go into a slow death of sorts.